Welcome to Ceva Piglets Health Talks, where we have invited guests in the studio to a debate of what's going on in the stable. Your host is swine consultant from Ceva, Henrik Bæk Pedersen.
Welcome everybody to this episode called Iron Supplementation in Piglets. And today I have the two guys in the studio, and the first one, would you present yourself?
My name is Michael Agerley. I'm a doctor of veterinary medicine and part owner of Porcus, where we are 22 veterinarians servicing Danish pig farms.
Yeah. And the other one?
I'm Michael Albin. I work in Ceva. I used to be a practitioner like Michael Agerley, and today I'm working in Ceva and a technical person.
Yeah. Thank you. And today's topic is about iron, and but maybe I would like to widen it a little bit out and first ask you, Michael, that what do you see some of the most 2 or 3 important things in the first day of living at the piglets after they've been born?
Well, the first thing will always be that it drinks milk, adequate amount of milk. But second to that, it's to avoid known diseases, known problems in the piglets, where 2 of the most important ones are that we can get pale piglets if we don't give them a supplement of iron, and also the infection with Coccidiosis, which creates a very strong diarrhea later in the farrowing period.
Okay. And Michael Albin, why is iron so important in the first day of living?
It's it's important because we need to produce some hemoglobin to transport oxygen inside the blood. And to produce hemoglobin, we need iron. And the pig is born with only 50 milligram of iron. And that little amount is used within the first 6 days of its life. Since there's hardly no iron in the milk, we need to give a supplement for the piglet. Else, as Michael said, it will become very pale.
So you're saying that if we don't treat the piglet with iron, it runs out of iron after 6 days?
Yes, correct. The pig will run out of iron. It will look pale. It will grow slower. Your mortality, amount of dead pigs, will increase, and they also get sick more easily.
And you say that the sow are not giving any iron in the milk. So what to do instead?
Exactly. The sow does not give enough iron in the milk, and we cannot really boost the sow to give more. So we have to inject iron in the piglet to ensure it has enough iron.
And then what time do you inject the piglets?
We do it around day 2 to 4.
And that's for preventing running out of iron day 6, so you give it before.
Exactly.
So
we have to give it before we have a problem.
Okay. So is it necessary to inject your iron? Was it not possible just to add it to the feed?
It is necessary to inject it. We have tested it over many years, trying to supplement the pigs orally with iron through feed or dry powder iron, but we cannot reach a sufficiently high level of hemoglobin in the pig. So we have to inject it, but then it can be good to give a supplement also by focusing on feeding or adding some extra dry powder iron in the pens.
Okay. And what is the right way to measure, and what is the level we have to reach, Michael Albin?
Yes, in the beginning it's important to get a high bioavailability in the pig, and by giving injection, then it comes really fast, the effect of iron in the blood. And then later we can measure first time we can measure is at 14 days, and we want the level to be above 110 gram per liter. But if we are under 90 gram, it's the same as there are missing blood in the pig.
And what happens if they're missing the blood, missing the iron in the blood?
They grow slower and are more exposed to diseases because of a less functioning immune system. The next time we can measure, Michael, you suggested another time of measuring?
Yeah, so as you said, day 14, what we basically check there is that our procedures are fully working and in place, that the job is well done. On the iron supplementation we do by injection. Then it would also make sense to check the pigs at 21 days of age, because here our supplement is dropping off a little bit, but we start to have a higher oral intake of iron through feed or through powder supplementation. And we're also very close to weaning. So what we can measure on day 21 is the combined effort from injection and feeding or supplements is in place, and is the pig ready to be weaned with success.
Okay. I have heard about research from University of Copenhagen that if the pigs are low on iron at weaning, we also see a lack of growth after weaning if they are too low. Is that something you have been discovered?
Yes, it's true. Roughly, we could say if we are 10% too low in iron, the pigs will grow around 20 grams less per day the first 3 weeks. That's a very rough estimate. And we see that. And we see when our iron supplementation is correctly done, and we can measure, we have good values on hemoglobin. We see we have nicer pigs. They also look pink like they should, and we have a much better upstart after weaning.
Now you're telling me that the iron is so important, why can we just give some extra injection, Michael Albin?
Well, that's not a good idea, because it has been proved scientifically that the 200 milligram is the perfect initial injection of iron. If you give a higher dose, it becomes toxic for the pigs in the kidneys. So first thing, injection 200 milligram, that's perfect, and then we add with an oral supplement later in life, day 10 to 14.
And with most products of iron, it would be 1 milliliter.
Correct.
Michael Agerley, I would like to ask you, what is your recommendation and what is most common to do in Denmark about the iron situation?
Well, in Denmark we have learned that we need to pay a lot more attention to this area. After we started to measure on the pigs, we could see basically in all our farms, the piglets had too little hemoglobin. So what we have done is to focus, of course, on the primary injection that is done correctly with the correct amount, 200 milligrams. But we can also see, maybe because we put attention on it or because our sows get many pigs, that it is really beneficial to give a supplement. This we do in a few different ways, but one very good way that is always important is to focus on the pigs. The piglets have a good feed intake because they get a supplement through the iron. If that is not enough, we can give a powder iron a few times per week from the second week as a supplement. And some farms have milk systems where it's also possible to put a supplement in the milk system. Basically, what we always will do is measure that we reach our goals on the hemoglobin level of levels above 110 grams per liter.
Thank you. And I think we have to jump to the next topic, and that will be the coccidiosis. That was the second thing you mentioned, Michael Agerley, that was one of the two most important things to take care of.
Yeah.
And I would like to ask Michael Albin, what do you think about the coccidiosis situation in Denmark, and what is normally to do?
Definitely, coccidiosis is a parasite that is on all the Danish farms. So that's why we treat 98% of all newborn piglets, and we like to treat them quite early, from 24 hours in their life. And that's to make sure that we get efficient treatment. Immediately they start taking ocyst from the pen, these zoocysts develop into coccidiosis disease inside the intestine of the pig.
And I'd like to follow up with a question: what happened? What really happened when the oocysts are going into the pig? Are they not able to eat, or are they getting sick, or what happened? Why is this a problem for the pig?
The oocyst, you could also call it, it's like a parasite egg. So when the pigs eat these eggs, they get the parasite infection in their intestines. And this infection is living inside the cells and destroying the cells. So basically we are destroying the ability of the intestines to digest feed or milk. As a result of that, we have pigs that grow slower and are weaned with less weight.
So even though they are eating, they are not growing because the feed cannot go into the body because the oocysts are destroying the intestine.
Exactly. The intestines are partly destroyed, so they cannot fulfill their function, which is to absorb the feed. I remember, now it's many years ago, when I was working in sow farms, we did not have toltesoril, which is the treatment against coccidiosis. But when we got it, the weaning weight increased with 500 grams.
And 100% agree with you, Michael. And one of the first signs we see if we don't have an efficient treatment against coccidiosis is diarrhea. We can see day 8 to 11 and then again at day 16 to 20 because it comes in two waves. And the sign of that diarrhea, that is a yellow, creamy appearance.
Yes. It's exactly like you say, yellow, creamy appearance. It does not look so dramatic when you see it. The pigs still look more or less. The mortality does not increase that much, maybe a little bit. But the main loss is that we wean piglets that are too small and that already have a bad infection in their intestines, which is a very bad place to start being taken away from your mom or from the sow.
Is there any other kind of diarrhea together with coccidiosis increasing the problem about diarrhea situation for the piglets? So if we have one diarrhea plus another diarrhea, then we have a huge problem.
Yes, for sure. If we add more diseases to the mix, the outcome is even worse. So, for example, if we do not control the coccidiosis with toltesoril well enough, and we have rotavirus infection, for example, and coli infection, then we get a really big problem in the farrowing unit, and then we also will see more dead pigs and a big weight loss, quality loss.
And I must agree, because those eggs from the coccidiosis, they are already start to enter the cells in the intestine within the first days of life. So I must agree.
What about the situation where we have the coccidiosis and we have been running too late after treatment? Is it possible to do anything about coccidiosis if we haven't treated with toltesoril before?
It's a very difficult disease to control if you start the treatment too late. You cannot control the infection anymore. There is a little effect on some antibiotics, but it's really little. The best way to handle this is immediately correct your procedure. Check the diagnosis. If you have a problem, send shit from the piglets to the laboratory or the whole piglet. If they find eggs from coccidiosis, then you need to go through your treatment procedures and also, of course, your hygiene procedures.
So it's both hygiene and the procedure about the treatment that's important to evaluate.
Yes. And with coccidiosis, it's a very resistant parasite, so you need special disinfection products that can kill this parasite, which not all can do.
And Michael Agerley, how do you see the best treatment of coccidiosis?
What is very important is that we give it at the correct time. And in most farms, that would be 48 to 72 hours after birth. Secondly, it's very important that we check that we give the correct dose. Especially if we give toltesoril against coccidiosis orally, we have to make sure our pumps are working properly, but we also have to make sure that the pig is actually swallowing the medicine to have effect. We can also give it by injection. And with injection, sometimes it's easier to make sure that the pig gets the full dose. But of course, we have to handle needles instead.
Okay, thank you. Thank you, guys. And to wrap up this episode, there was 3 things who was very important to secure the growth of the piglets. The first was milk, obviously. And the 2 second one was to know the level of iron in the blood of the piglets. If it's too low, they are not growing. And the third one and last one is that to be careful about the coccidiosis treatment. If they are not treated correctly, it will also influence on the growth later on. So thank you.
Thank you for listening to Ceva Piglets Health Talks. Please stay tuned for the following episodes.